I'm attorney Ramsey Bahrawy, and this is Your Money, Your Life. Have you or a loved one been diagnosed with dementia, which is diminishing your ability to independently care for yourself? Then listen up, because I'm sure you'll find today's program helpful, enlightening, and yes, captivating. My guest is Gerry Gallin. She and I will discuss your pressing questions about assisted living services for the memory impaired at Evita of Newburyport. Gerry Gallin is the corporate marketing liaison for the Northbridge Companies, a company providing the next generation of senior living. But that's not all. Currently, Gerry also serves as the executive director of Evita of Newburyport, a state-of-the-art senior living community dedicated to memory care and located immediately behind the Anna Jakes Hospital in Newburyport. Gerry, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you, Ramsey.
Now, Gerry, I've noticed that people oftentimes have a very real confusion between what is assisted living, what is nursing home care, and what is independent living. So once and for all, could you explain what is assisted living?
Certainly. Assisted living is independent living quarters within an assisted living environment. Excuse me. Our residents that live in assisted livings have their own apartments with a private bathroom. Some have kitchenettes, and they live within a community where they can get assistance with things such as bathing, dressing, medication reminders, escorts to meals, assistance with going on trips, escorted services to doctor's appointments, things of that nature.
Okay, so basically they're getting some help, but still live independently.
Yes, they do live independently. There isn't somebody checking in on them 24 hours a day.
Okay. You mentioned certain types of assistance. Is there like a menu of services they can choose from? How does that work?
Well, you discussed or mentioned independent, assisted, and nursing home care. Well, independent living is truly just an apartment setting so that a resident has the features of a dining room so they could go down and have their 3 meals a day, but no one is checking on them or giving any hands-on assistance to them. It's independent living, once again, within like a condominium situation where they don't have to do any maintenance on the apartment or externally or internally on the apartment. Assisted living would be where I mentioned the 3 meals a day. Typically in an assisted living there are basic things that are included, such as 3 meals a day, all your utilities, sometimes cable and television are included. There's a nursing staff on site. Medications, I think I mentioned to you, and if somebody needs transportation, they can get concierge services. The basic assisted living package is approximately an hour of services a day.
Okay.
And by that I mean hands-on services, bathing, dressing, medication reminders.
Now you mentioned there's a nurse on the premises. Is that nurse there 24/7 or limited hours? How often is the nurse available?
Some assisted livings do have 24-hour nursing presence. In an assisted living, nurses are not allowed to do true nursing care. The purpose of having a nurse there is for them to be able to assess a situation. So if it's a 911 call, if it's something where it's life-threatening and somebody does not have a do not resuscitate, then they will call an ambulance. If it's something that they do not feel requires any medical attention, immediate medical attention, then they will assess that situation. They're not allowed to do injections or wound care or anything like that. So the purpose of having a 24-hour nurse on site depends on the assisted living themselves and what their wants are. Usually we find, at least in my experience, is that approximately 16 hours of nursing care a day is appropriate for the waking hours of most of the residents. And then we have a staff, quite a large staff of certified nursing assistants that have been trained specifically in the environment by the organization that they are working for, that are able to take some direction from a nurse. If it happens to be, from my experience, the 8 hours when a nurse is not there. A telephone call will be made to the nurse that's on call, and an assessment will be made.
Now, Evita at Newburyport, that's going to be completely memory care.
Completely, yes.
So does that mean that your staff will be trained in memory care types of issues?
Yes, it is.
That's important.
It's very important to me. I mean, my true passion is working with people with memory problems. And memory issues are not just Alzheimer's. It can be a stroke-related memory problem, a vascular dementia, an age-related dementia. So there are a variety of different causes for dementia or dementias that are related to other diseases. At AVITA of Newburyport, this is our third. I work for the Northbridge companies, and we have a number of assisted livings throughout New England. But this is our third AVITA. And AVITA actually is a brand name that we are using in our other organizations that also have independent living, assisted living, and then a section which is devoted to memory care. For my purposes, for AVITA of Newburyport, there will be 70 apartments. They're individual apartments, and I describe them similar to a hotel suite. It can fit a queen-size bed, a night table, a bureau, a little sofa, a chair, and an area where you could watch television if you wanted to, or just have a little bit of a sitting area with a private bathroom. They do not have cooking facilities at all in the apartments, and for obvious reasons, that if somebody has some memory issues, they might forget to turn off an oven, or they may put something inappropriate into a microwave, or they may use a refrigerator area for a storage space. And that is to avoid the confusion for the resident themselves.
Right. Now, getting back to the rooms for a second, it's my impression, and please correct me if I'm mistaken, that each resident will have their own room. Is that correct? Or
Yes.
Or are there sharing rooms?
There are 8 apartments that will have shared rooms. They will, I wouldn't say they're shared rooms though, we call them companion suites. You walk in the front door and there is an apartment to your right and an apartment to your left with a small sitting area and a shared bathroom. That's to cut down on the cost for some of the residents. Or there are many residents that really do prefer to have that open space where they know somebody is right next to them. And it's very important to match them up with their abilities.
Will AVITA of Newburyport accept people at all levels of dementia?
Well, one of our criteria is that we do not like to have people come in that are a 2-person assist. So if somebody can come in a wheelchair and they can assist us with getting them out of a wheelchair and assist them in getting dressed or using the bathroom, then we will accept them. It's difficult to accept a 2-person assist. By that you mean like a couple? Well, not a couple, but if it takes 2 aides, certified nursing assistants, to raise someone who's not weight-bearing whatsoever, would not be appropriate for an assisted living environment such as AVITA. If the person progresses to that point, we will work with a family and do our best with keeping them at our community for as long as we can.
All right. So the answer to my question is you will accept most levels, but not all levels of dementia.
Correct.
Yeah. Okay.
Well, it's not really the dementia as much as it is the physical capabilities, And there are certain types of dementias that are not suitable for assisted living.
Now, what about a couple and both have dementia?
Works very well, yes.
That works well?
Yes, it works very well. And it even has worked well in our other AVITAs. As I said, this is our third AVITA. One is in Needham and one is in Westbrook, Maine. And we had many couples there. And sometimes it would be one spouse would have dementia, the other did not, but they wanted to stay together. So the person who had the dementia or whatever the diagnosis was associated with the dementia, would receive all our care, and the spouse got a little bit of a break. So he or she might be able to take off for the day, knowing that their spouse was going to be very well cared for.
Okay, so it's kind of like respite for them.
Yes, it is. It's a respite for them.
For a lot of people, the difficulty in terms of looking at assisted living is, you know, where do we start? Like I said, there's a confusion as to what assisted living even is. And so I was wondering if we could sort of just engage in a little conversation here where I would act like the family member.
Certainly.
And you be the salesperson, so to speak. And hopefully the people viewing this will follow along and understand what some of the important questions may be. So for somebody to go into assisted living, they have to be assessed first, right?
Correct.
When does that assessment happen?
Well, first of all, the family member would be coming and visiting us. I always suggest that it's not the resident, the potential resident themselves. It's a son or a daughter, if at all possible.
Sure.
The situation is discussed, and then depending on the agreeability with the family and the person that is the possible resident, then we would make a decision as to whether they should come in and see the building itself and the apartments, or if we should go out and meet them, possibly, or have them come in and meet us. And then that assessment would be a preliminary assessment, meaning that if it were me, I would be talking to the person that would be the potential resident and ask a few questions that wouldn't be too intrusive and get a feeling for what their capabilities were physically and also what their capabilities were mentally.
Okay, all right. And then after you've made your assessment, does a physician or a professional also assess the potential resident?
Yes, a physician's form is necessary. So we would, if the resident's family has decided that this would be an appropriate placement for their loved one, or the loved one has agreed to this, then we would fax or send or mail or give the family a physician clearance form that would give a complete history of the resident.
Now, after that initial assessment, is there a reassessment somewhere down the road?
If the resident comes to us, yes. After 3 months, we reassess all our residents and see how they have progressed in the progress. Some have improved tremendously, and others will have a little bit more difficult time.
Okay. At that 3-month stage, is there an opportunity for them to get additional services if that's necessary?
Yes. The basic services for an assisted living, as I was saying before, is for the hands-on services is approximately an hour. Some places do 45 minutes, others do an hour. And I understand now that some assisted livings are actually letting you choose an a la carte menu to come into their building. So they might just be receiving the 3 meals a day. And then they can choose a la carte services. Within my organization, we include an hour's worth of personal care assistance. And then if they need more, they're available for them. And it can be broken down into 15-minute increments, or it can be packaged in a different way.
Now, if one of your residents decides that they would like to bring in an in-home care provider, can they, at their own cost, can they do that?
Absolutely.
Absolutely.
Yes.
Okay. So that's another option that they have.
Yes, they do.
Okay. All right. Well, that's good to know. So they are reassessed, and then they can get more services if that's necessary. Of course, it's going to cost them more if they get more services. So
yes, it is.
We want to make that clear, too.
Well, another point that I want to make out is that we don't have to wait until a reassessment comes about.
Okay.
If we do notice that a resident is having a difficult time fitting into that 1 hour of personal care, we are not going to do it just because they need an hour and 5 minutes or an hour and 10 minutes. But if we're seeing that they are really struggling more than what we are offering, then we will suggest that they purchase another package or some more.
So there's flexibility.
Lots of flexibility.
That's good. That's good to know.
I actually want to say that one of the greatest parts of Evita, of Newburyport, and I think of a lot of our companies, communities, is that it's a custom package. We really don't have any specific guidelines other than the guidelines that we must follow by the Executive Office of Elder Affairs, and that is we're very stringent about. We stick to all those regulations. But if it's something that within the 45 minutes or an hour of personal care that somebody would like to go for a walk for 15 minutes, we will work very hard to arrange that as part of their care plan. Or some residents like to do laundry.
Right.
Some residents like to fold laundry or set the table or do a variety of different daily tasks, so we'll incorporate that.
Okay. Now, it's my understanding that when a resident first moves in, there's a written care plan, is that correct?
Oh, yes.
Okay.
Mm-hmm.
Does the resident and or the family have any input into that care plan?
Tremendous input.
Okay.
So before a resident moves in, and I'm only speaking for the properties that I've worked on,
That's all
which
I'm
is all I
asking
can
about.
say is
Right.
that there's a very extensive interview process that goes on just with the family. It's about a 12-page questionnaire, and I actually do it with the resident as an executive director.
Okay.
Resident's family, the types of food they like, when they wake up in the morning, what their favorite television show is, favorite book, favorite game show, anything
Right.
that's been important to them in their life. Do they like pets? Do they dislike pets? Do they have any allergies? Their favorite meal. So that especially when they first move in, what's their favorite breakfast? Similar to if you were staying at a bed and breakfast, somebody would prepare after knowing you for a little while what you like for your meals.
Yeah. You mentioned pets. At Evita of Newburyport, will pets be allowed?
We have to interview the pets.
You have to interview the
Yes,
pet?
we do.
How does that work?
I want to see that dog or cat. And we have a certain weight limit, really probably about 35 pounds for a dog.
So nothing too big.
No, nothing too big. We don't want big barkers,
Uh-huh.
and we don't want any kind of a dog that will intimidate any of the residents, that has any aggressive behaviors. Now, it seems funny to have to assess that in a short period of time, but you can get a pretty good feel if this is a calm dog or a very aggressive dog. And the resident has to be able to take care of that dog to a certain extent.
Right.
We can do the reminders to take the dog out and things like that. Cats are definitely allowed. We really encourage them to stay in the room more because there are more allergies to cats than there are to the dogs.
It's true. All right. So an adjustment has to be made.
Absolutely.
Now, what about smoking? Is there a prohibition?
Some buildings have a no smoking policy, completely. But if it is something that somebody has done for 50 years, and they want to continue on a scheduled basis, but they would have to be escorted with somebody to go out and have a cigarette. And it certainly wouldn't be on a regular basis, It's not just on demand, but we would hopefully redirect them until the time it was for them to have another cigarette.
Now, if my loved one were going into a facility like that, one of the things I would want to know is how robust are the activities that you provide?
Well, always we provide robust activities, but it depends on the residents' wants and needs. We can make up a beautiful program that looks absolutely delightful to a family member. But if your mother is not interested in the opera, the theater, I'm not going to provide that. In fact, what I'd like to do is take the information that we receive from the family and the resident upon their interview and see if we can create a rich programming schedule for them so that they will enjoy it. Whether it's bowling or it's, we've taken residents that have dementia, a group of dementia residents out bowling, and they've loved it. Or there might be others that have really enjoyed the symphony, and they still enjoy it now.
Now, will Evita at Newburyport have any outdoor walking paths where the residents can walk?
Well, we have beautiful outdoor space. I would not say it's a good walking path per se, but each neighborhood, we have 3 different neighborhoods, and each neighborhood has an absolutely gorgeous garden with a water feature and a nice small area to walk around. If I have very active residents, I form a walking group. And our program director, we have nice area around the building, but you would have to be escorted once again, just for any wandering or confusion issues. And where we are near the beach, my hopes are that we're going to be able to take some of our residents out to the beach to go for a nice walk.
Oh, that would be very nice. Yeah,
it would.
Now, you mentioned wandering. I would presume the facility is secure so people can't wander, they can't leave the building?
Yes. But it's also in a disguised manner. And how I explain to the residents themselves, if they're coming in, that we have a keypad and it's a security code similar to what I have at my own house for security reasons, so that we know who's coming in as well as we don't want anyone to be disturbed. And so it's more of a courtesy than it is any of a containment or a confinement type of a situation. The intent is not for confinement whatsoever. It is not a psychiatric unit. It's not a lockdown. It is truly a security measure so that we really can keep track of who's coming in.
Now, what if you have a resident who has what I will refer to as bad behaviors? How does the staff handle that?
The first thing that everybody is trained to do is to redirect. Most oftentimes, you can get a resident who is feeling quite angry, distressed, upset about the move. If you redirect them into something that they might be interested in, such as a book that they have read, or a play they have written down, their family had written down, you always have cues as to what can calm a resident down. And redirection is key. That's the largest part of our training.
Okay. And then obviously your staff is trained to do all of this. That's the important part. Now, what about the inside of the building and safety features? Plenty of lighting, floors aren't too slippery, that sort of thing?
Correct.
I'd want to know that too if my loved one were moving in.
Yes.
Because elderly people, they will fall.
Yes.
Any fall prevention techniques that you use?
Well, we do a fall risk prevention and a fall risk assessment for the resident when they come in. So if we know that somebody's a fall risk, we will do our very best to keep a tremendous eye on that and work with a physical therapist. There has been some recent study that says that, I was just speaking to the president of our organization about it last night, actually, that muscles remember. Although the brain does not remember how to do certain things, the muscle remembers the reflex, and therefore it's been proven that it's very important to keep activity going, physical activities going.
So you're talking about muscle memory.
Muscle memory, yeah.
Yeah, that's true. There is such a thing.
Yeah, very interesting. Even, you know, that really fascinated me in terms of with residents with any kind of memory loss.
Anyone who's been an athlete knows that you all have muscle memory, absolutely.
Right.
Something else that I would really want to know if my elder loved one were going into an assisted living facility, and that is, what would the ratio be of staff to residents?
We have a ratio of certified nursing assistants to a resident of a 7-to-1. Now that is just the certified nursing assistants. But in addition to the certified nursing assistants, we have nurses on staff, we have program directors on staff, program assistants. Each manager is assigned a neighborhood to go and visit 3 times during the day, every day. And we have a variety of other entertainers that come in. So the actual physical certified nursing assistant ratio to resident in my company is a 7-to-1 on a memory care.
Okay. Now I'm going to change gears here
Sure.
and talk about the finances for a second. So it's my understanding that the relationship is a landlord-tenant relationship. So there's a lease that's in place?
Yes.
How long a lease are we talking about?
Residents or resident families sign a 1-year tenant at will.
Okay.
It's called a residency agreement, other than not a lease, but for legal terms, it probably is a lease.
It is a lease.
Yes.
Yeah.
And so we require 30 days notice upon a death, because it's a landlord-tenant situation, and 30 days notice if you have to move out of the building due to medical needs.
Okay.
If you just want to move out, it's 60 days notice.
Okay.
But you're basically a tenant at will, and the purpose of the lease is to hold true to every one of the agreements that the landlord has made to you. Like, we can't increase the rent, we can't change our services based on what you've signed.
Health insurance doesn't pay for assisted living.
No, it doesn't.
But long-term care does.
Yes.
And then people can also
Not all
private pay.
long-term care.
Okay, tell me about it.
Yeah, it depends on how the long-term care policy has been written. many years ago, and many of our residents now have long-term care policies that only take care of nursing homes. I am finding more and more now that people are coming in with long-term care policies, that they've changed the regulations now to include assisted living. So more often than not, if someone reads their long-term care policy, they should check with an attorney. And
Good place for us to stop, Gerry.
It's a very
For many people, the day will come when dementia will diminish their ability to independently care for themselves. As a consequence, they will be compelled to consider alternate housing choices that provide assistance with activities of daily living. For many people living with dementia, the ideal choice is an assisted living facility dedicated to memory care, such as Evita at Newburyport. I say ideal because an exquisitely designed Evita at Newburyport is more like a home and less like an institution. The services available to residents at Evita of Newburyport will provide peace of mind to both residents and their families. Before you go shopping for an assisted living facility, take stock of the needs of your loved one. Is he or she safely living at home? Does he or she need assistance with activities of daily living? Does he or she suffer from cognitive impairment? The answers to these questions may help you to determine the correct type of care for your loved one. Also remember to ask what, if any, estate and financial planning has been accomplished. Advanced planning may simplify the decision-making process. Remember that planning for age-related cognitive infirmities earlier rather than later is the most prudent course of action. Such advanced planning likely will assure peace of mind that your loved one will receive the proper care. Therefore, educate yourself to become more aware about the services offered by assisted living facilities such as Evita of Newburyport. For as Ben Franklin is quoted as saying, an investment in knowledge always pays the best interest. In closing, thanks to my guest, Gerry Gallin. Gerry, thank you for being here.
Thank you for having me.
It was a great conversation.
Thank you.
And as always, thank you to you, our viewers, for watching Your Money, Your Life. I'm Attorney Ramsey Bahrawy, building your trust.